Hey guys, welcome back to the channel. Welcome back to Preparedness 2020. As you guys know, it has been a horrible year. The election is coming up at the time of this filming. Things are really bad. People are getting hurt. People are getting burned out of their homes, their businesses, losing jobs, losing family members due to COVID. So it only behooves you to get as much medical training as you can before you even touch a first aid kit. Now, I'm not talking boo-boos and band-aids and that kind of stuff. I'm talking real trauma issues. Get your training. You can go to the American Red Cross. You can go to accredited college. You can go to a TACMed or any place that teaches tactical medicine. Be sure that they're certified. They are certified EMTs or EMS. Any training that you get is going to benefit you in the long run. You also have to practice it, and you also have to recertify every single year. Okay. That being said, myself, I am a trained first responder, so I have a lot of the tactical training that is also necessary to apply tourniquets, to apply wounds to bandages, that kind of thing. I have treated gunshot wounds in the field. I've also served in the Marine Corps for 10 years, so I'm very familiar with what gunshots do to people. I'm very familiar with bleeds, all that kind of stuff. All right. Also, if you have children, get the infant training. Okay, there is specific things that you need to know for infant training. Children choke all the time on stuff. You need to know how to resuscitate them. It's not the same as an adult. Okay, someone has a pacemaker. You need to be aware of that and what you can use. That kind of stuff. Practice in AEDs. All the technical knowledge is out there. You just have to go and get it. So before you pick up a medical kit, before you apply a tourniquet, make sure you get your training. All right, enough of that. All right, so what I'm going to do today is I'm going to show you a couple of kits. Okay, the kits that I have are specific to me, my training, what I have used in the field, and what I know works. All right, so we're going to go along with that, and then hopefully you'll enjoy this video. Please like and subscribe, do all that good stuff. Again, I am not a doctor. Okay, so if you're trying to be a doctor at this, it's not going to work. What we have here on the table is basic medical kits that you get from CVS or any of your whatever drugstores you have. All right, this is good for boo-boo ouch stuff, minor cuts, minor scrapes, minor burns, minor itchiness, stuff like that. It is not good for any type of trauma. Okay, so I'll just open this up. I'll show you what I have. Now, this kit I bought, and I actually put a little bit more stuff in there, but you're going to run into stuff like, you know, a little bit of gauze, some ice packs. All right, I think this has iodine in here. Yeah, these are iodine swabs. Okay, more gauze. You're going to get like a lot of band-aids, like crazy amount of band-aids, alcohol swabs. Really cheap scissors. You'll get antibacterial ointment. Maybe you'll get some ace bandages or compressed bandages. All right, you get a little bit of band-aid stuff, but that's it. So, you know, this is not really good for, you know, if you are going to try to use it for a bug out, if you're trying to use it for major medical stuff. What it is good for is if you have, you know, if you're on the playground with little kids, they're going to get scrapes, they're going to get boo-boos. I myself have cut myself once or twice making dinner. Okay, so that's kind of what this is, unless you need stitches. This is a secondary one. This I carry most of the time. This is in my EDC bag along with my trauma kit. I can tell you that I have used this kit before. I was upstate in the woods. I was cutting a lot of logs and timber, and I wound up cutting myself pretty bad. And I don't know if you can see that, but all this little dark spots right here, that's my blood. On this bag, what I did is it comes with a little bit of that, and then I added some boo-boo ouch stuff, headache medicine, some tape, some gauze. I have a CPR shield in here, some Benadine solution, more gloves, and then I also put a trauma bandage in there. Okay, I didn't need the trauma bandage. Some shears. These are cheap shears. Actually, get better shears. There's a lot better ones out there. So get the better shears. A little bit of burn ointment. Okay. Again, this is not a major bleed. This is not what this is. This is for the boo-boo ouch stuff. You can do a little bit of medical stuff on here, but it's not really worth it. What's good about this pouch is that it's small enough that I can carry it with me. Okay, it has the belt loops, but I never use that. I just throw this in my bag. If you have an everyday carry bag, this kind of pouch works great because it's small, it's compact. But what you need to do is you need to pair it up with something like this. Okay, these are IFAKs. I make my own IFAKs. I know you can buy IFAKs. I know there's a lot of companies out there that build their own kind of stuff, and it's great, it's good to go, but I do my own stuff. All right, so any type of clotting agent is going to work great for any type of major bleeds. This is an Israeli bandage, okay? Any type of H&H bandage, H bandage, trauma bandage. Basically, it's a big pad where you can cinch it down really, really tight, okay? This is a Gen 4 soft T tourniquet. You can also get the cat tourniquets, pair of gloves. That's pretty much it, all right? I have a couple different sets. I'll show you. And what I do is I put them in every one of my bags, cars, that kind of thing. So this one has a cat tourniquet, some quick clot. This has an H&H bandage, quick clot, trauma bandage in there, a cat 4 or cat 5, yeah, cat 4. Again, this is another one. This is a compressed H&H bandage, and this has a cat tourniquet. Has combat quick clot, combat gauze, and again some heavy-duty gloves. All right, so these 4 right here, anytime I go to the range, I throw one in my bag, or I have one in my bag. Anytime I go for a bug out kit, one's going in there. All right, it's not heavy. When I go hunting, I put one in there, okay, because you can get shot while hunting, believe it or not. This will fit about the size of a cargo pocket. All right, so it's a nice size. It's about 6 by 9, I think the bags are. I'll put the links down below if you guys are interested. But what you do is you buy your stuff individually. Sometimes you can get it on sale. Sometimes they sell it in 3-packs, and then you build your own kits. If you're going to buy tourniquets, make sure you get the right ones. The cat tourniquets, I buy them from North American Rescue. This way I know I'm not getting screwed. I'm not getting some cheap China crap. Also, the Israeli bandages, make sure you get the right ones. And the soft T tourniquets, again, it's another type of tourniquet. It works really well. This is the soft TW, which means wide. Excellent tourniquet. The tourniquets are going to cost you about $30 to $40 a piece. So they're not cheap. I get it, all right? But when it comes to medical supplies, don't be cheap. This can save your life. If you have a patrol bag, if you're a police officer, throw that in there. If you are a school teacher, take 3 of these, throw them in there, okay? Active shooter, just because we haven't heard about it doesn't mean it's not happening. What's good about this system is I could put a couple of these inside of an active shooter bag or a response bag, and then what happens is if I'm trying to clear a building, I could take this, throw it to my buddy Jim, Mike, Ralph, whoever, take another one, throw it to him. They can fix themselves, and I can continue on with the fight, which is exactly why I make individual bags like this, little sets, okay? Another one that I've been using for the summertime is a smaller kit, as you can see right here. Now this has a rat's tourniquet. I know a lot of people don't like rat's tourniquet. The medical professionals don't like rat's tourniquet, but it's better than a belt, okay? So this kit right here, I kind of made, which was for summertime carry. I carry this a lot during the summer because I don't have that much clothing on, okay? Same principle, only I'm using a rat's tourniquet, okay? And if you don't know how to use a rat's tourniquet, go to the website, check it out. But what's good about this, it's also good for, I know they say it's good for small children, that kind of thing. Hopefully you'll never have to use it on a small child. I don't want any small child getting put in a tourniquet, but to save their life, you will. And then all I did was I made a smaller package, okay? So this is the gauze, this is the quick gauze hemostatic dressing. This is a small H bandage, okay, HH bandage, and a small set of gloves. You can see how small it is in comparison. So if you're out there spending, I don't know, maybe $100 on the XYZ name bleed out kit, just buy your own stuff and put it together. It's all the same stuff, I promise you. All they're doing is you get a case of gloves, 100 gloves. You buy the H&H bandage, buy a bunch of those, buy some type of hemostatic agent gauze, or if you can't buy that or can't find it or it's too expensive, buy the compressed gauze, okay? It doesn't have any hemostatic agent in it, but you're going to have to push that inside of a wound and eventually it'll stop if you can find it. So North American Rescue, I highly recommend them. If you can't find Quick Clot, that's your next bet. Gauze, 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 gauze will stop bleeds, okay? And then some type of tourniquet. Now, everything that you see here is very easy to make. It's really not that difficult. I'll show the bags that I purchased. I buy them in cases because I also use them for other things. But these are very, very thick. These are about 8 mil a piece. 8 mil thick. So they're very, very thick, clear plastic bags. You don't want any water or mold or mildew or anything to get inside them. You want them waterproof, okay? You don't want anything messing with the gloves, etc. All right, this tourniquet I have to put on the outside for obvious reasons. You could also carry these separately if you like. Some people carry 3 or 4. All right, so this is a little bit of first aid, boo-boo, ouch stuff. This is trauma. Now, what I'm going to talk about next is trauma kits. Other than the stuff that you see here that you can make, they do sell trauma kits specifically for in-country combat fighting. I think EMS carries their own, like if you ever seen EMS, they have their own duffel bag. That's what's in there, is basically all that stuff. All right, so let me put the camera on pause and then I'll bring it up to the table. All right, guys, what I got here is a military grade trauma kit, mostly used for combat medics. This one is made by North American Rescue Products. They make excellent kit. All right, this was probably contracted out to the military. What I like about this kit is that you can use it for either a fanny pack or a backpack. You also has MOLLE capable. You could also strap it up to any type of rig or backpack. Okay, so really universal. Also, on the outside, you have a nice trauma shears, very easily to get to. You just unclasp this, and you pull out your trauma shears. Pretty good trauma shears. Now, this is a very expensive kit. It's not cheap, but what I like about it, it's compact enough that you can put it in your vehicle, fit it in the back of your car or behind the seat, that kind of thing. It works great. Up here, it usually have some gloves up here, but I put my my headlamp, all right, because it's going to be a lot easier to work with a headlamp hands-free on any type of patient or yourself. It's got some extra batteries in there as well. So as you open up the kit, all right, it has some webbing up front, so whatever you want to put up there, some tourniquets, some gauze, nasal pharyngel, I can't say this word, let's say it right, okay. This one's kind of, okay, nasopharyngeal airway, okay, lubricating jelly. All right, probably have to replace these. They're probably getting a little bit old, but basically, if your face is torn apart and we need to get an airway, we can put an airway in. Okay, so you got a light here, scalpel, some face masks, N95. I also have in there this, which is it's just basically for the vehicle. It's a vehicle safety. If you need to break the glass, I don't know if you ever try to break some tempered glass, but it's really difficult. So these hammers have a specific point on there, able to get in there. Also, it has a seatbelt cutter as well. You should have this in every single vehicle. All right, gloves, trauma bandages, black Sharpies. Okay, black Sharpies are for the tourniquets. I have quite a few tourniquets in here. I also have some splints. I have bandages. I have petroleum. This is for any type of burns, so I have burn dressings in here. I also have some more Quick Clot, so anything that's going to stop the bleeding really fast. I also have priority cards, so these cards are for anybody describing as what type of trauma, what they have, what was the last check, that kind of thing. And then the priority cards, meaning, is this person savable or not? Is it routine? Is it immediate? How do we evac that person? These are called evac cards. Really important stuff to know if you have a mass casualty, such as you know, the Boston bombers. Okay, they blew a bunch of whole people apart. So, you know, based on if they had survivability, we could use those cards. Okay. We got some needle decompression needles in here. Like I said, a whole bunch of gloves, tape, gauze, tape, gauze, tape. I do have a little bit of band-aids, boo-boo, ouch stuff, but that's not really what this is for. Alright, so this is a very small kit, but again, it's not cheap. It's filled with all the goodies, okay? A lot of stuff. Now let's look at the house. I have actually even a bigger kit that if we were going to leave our area, operation, we're going to be gone for an unknown time, and we want to take medical with us, I have a backpack specifically for that. Alright guys, this is the Black Hawk backpack medical unit. I don't think they make these anymore. This one's pretty old. I got this on surplus. When I was in the Marine Corps, I had a lot of corpsmen probably fall down from humping and rucking all this crap. Alright, it's the fucking house. It's huge. It's got a lot of stuff in it. It's made for people that jump out of helicopters or aircrafts. It's actually jump capable. The backpack itself is not uncomfortable, but once you stack this full of stuff, it's very heavy. Okay. The idea behind this is, you know, it's a base hospital in a bag. All right. I don't expect to be humping this anywhere. I'm going to throw it in my car, go to my bug out location, and then dump it. Or better yet, just put this at your bug out location, and you don't have to hump it anywhere. It's got all the medical stuff you have in it. All right. So it comes in a 2-zipper format. All right. The first part, or clamshell, the first part of the clamshell has mostly all my trauma stuff. Mostly, not everything, but mostly. Okay. So I'll try to open it up for you. All right, this is a very well thought out backpack, except for the fact that it's heavy. Okay, trauma shears. I got a whole bunch of little aids, pain aids here, like little stuff, no big deal. In the back here, I got trauma bandage, a bunch of rolled gauze. Okay, more rolled gauze. These are all tourniquets. Okay, I got 4 tourniquets in there. I also have gloves. These are the very thick gloves. Okay, they're also used for NBC. That's how thick they are. I also have other gloves inside this pack. H&H bandages, surgical tubing. These are 9s. What are they? 5x9s. I also have. This is the iodine solution. Pens, lights, thermometers, all that kind of stuff. Inside here. So you can put more stuff in here if you like, but inside here, surgical lube. Okay. I also have, again, more. All right, neopharyngeal airways. I can't say it. All right, NSAs. Okay, so there you go, the NSAs. I haven't used one of these in a long time, but honestly, if you are trained in it, this one might not be good anymore. But if you are trained in it, it's a good way to restore or to get oxygen back into your body if your face is completely destroyed. Okay, so it behooves you to learn and relearn how to put one in. When we were in school, we actually did it ourselves just to know how to do it, and believe me, it sucks. Okay. Again, on this side, more trauma stuff. So I have hyphen chest seals, face masks. All right, I have the abdominal pads. These are really big pads. You can buy these relatively cheap for major wounds or large wounds. And then I have an IV start kit. I have 2 of them. I don't have any IVs. If I had IVs, I would put them inside these pouches, okay, because I want my trauma to be all in one clamshell. Don't have IVs. Again, 4x4s, triangle bandages, burn gel, tape. I have a whole bunch of tape in there. Alright, so this is going to be my trauma part of it, and then I'll zip this back up, and then I'll flip it over and show you what else we can put in here. Now again, make sure that you're familiar with all the equipment that's in here, so when you take this to wherever you're going, or drop it off to wherever you're going, you know what's in there. You can even do like a little inventory, see what stuff is expired, all that kind of stuff. So on the back side, it also clamshells. All right, And this is the stuff that they used to have little bags that would fit inside here. I don't know if I can find them anymore, but they would be different color or color coded. So one would be meds, one would be something else. This bag didn't come with it because it was surplus. But so rubbing alcohol, make sure if you're going to put alcohol in here or any type of liquids, make sure you seal the bottle, seal it up pretty tight, put it around a bag. Okay. All right, so I have cold packs, CPR masks. All right, this is on Narcan. I don't think anybody's going to have to worry about drug overdosing. Antibiotic essentials. This is pretty good. It's a small book that basically discusses causes, infections, what type of medical. If you're a medical professional, you kind of know what this is. But we always come up with these little cheat notes. And sometimes these little books could be lifesavers, especially if you're not practiced. Okay, this has a little zipper in here where I have my boo-boo out stuff. So I have Benadine solution, I have small 2x2s, and steri strips. Okay, steri strips are important when you lacerate yourself and you don't want to put the stitches in. Bunch of ace bandages, another splint, Sam splint. Okay, some more bandages. Let's see, I have some emergency blankets, good for treating shock. Antibiotic ointments, moleskin. Moleskin is outstanding. Believe me, I used to live on moleskin when I was in the Marine Corps. My feet were completely destroyed. I believe that the Marine Corps just destroys feet. That's its only purpose. Alright, this is a whole suture kit. Okay, suture kit, I have regular sutures in here and I also have staples. Okay, depending on your flavor. I also have cortisone ointment. This is not the medical brand, it's just regular cortisone ointment. It's better than nothing, but if you need to suture yourself or have somebody sutured, you probably want that. Alright, Special Operations Handbook. Again, it's a little bit dated, but medical knowledge that is going to be hard to come by. If your internet is down, you're on the run, you don't have the opportunity to go to medical school while you're running for your life. Alright, all these little book references are pretty good. Okay, pulse oximeter. Alright, if you don't know what that is, it's basically a little finger. You put this on your finger, it gives you an idea of where your oxygen level is. So, kind of important. My son did have and does have lung problems, so I'm always checking his oxygen levels, make sure he's good to go. Let's see if I can put this all back in there. Okay. They have upgraded this bag to be like half the size, specifically for the Marine Corps. I've seen it, and Navy Corpsmen, I've watched them do it. Probably Army medics too, because they were complaining this bag was too big. So they halved it, and they made it a half size, and it's actually a little bit better. In this pocket right here, this is all my little pain aids or medicines or stuff like that. So icy hot. This is allergy medicine, Sudafed or decongestant, Visine, more Sudafed, ibuprofen or aspirin, more allergy medicine, anti-diarrhea. This is sunblock, mercurochrome or more iodine, and of course Vaseline. Vaseline's really good for not only for your lips or whatever. You could also start fires with it if you needed to. Again, this is just my version of this. You can put whatever meds you need in here. Okay. You could put, you could stock it to the rafters with, ibuprofen. I myself, on a regular basis, use ibuprofen, so it's not in this pack other than what you saw in the beginning. I had like a little tiny pack of it. Alright, but I guarantee my bug out bag's going to have a lot of ibuprofen. Alright, so, last but not least, I don't want to pull this out, but this bag right here, if you can see it, it's all the way tucked here in the back. Is made for, it's a body bag, alright, but what's good about it is that it's military grade body bag. You can use it as a makeshift stretcher. Alright, I'm not saying you close the patient up in it, but the webbing on here is strong enough to hold a human body. Alright, so if you need a makeshift stretcher, it's there. And then of course if your patient doesn't make it, then you can use it as a body bag. Alright, so that is the house right there. That is the Big Daddy. That kind of sits in the corner until we have to leave here, and then it goes right in the truck and we take off with it. Okay, now let me show you some simple stuff. Alright, this is probably the easiest way to procure or to keep all your kit is totes. I told you before, I'm a big fan of the totes. It's very simple to buy, Sterilite, it makes really cheap products. I keep all my tourniquets in a separate bin other than this one. There's a lot of stuff in here that might be a little bit older that I'm not using, like TK4s. There's some military stuff in here, like you probably have never seen this one. This is probably some Vietnam stuff, like tourniquet, non-pneumatic, camouflaged. Alright, this is some really old tourniquet stuff. But and then of course I have the SWAT T tourniquet, you know, some other stuff that's probably fake. This is probably a fake tourniquet that I can use for training. Alright, so I don't necessarily have to use it on a patient or a person that's injured, but I can use it for training. Alright, so tourniquets I keep separate, and then when I'm out of tourniquets, I'll go buy more or upgrade them and throw them in that bin. As far as medical, you don't have to go out and get all the fancy stuff, okay? You don't. I'm not saying, like you saw the IFAKs, the individual first aid trauma kits. That's really all you need. You don't have to go this far. But as I was prepping and doing my preparedness, I wanted to have extra in case people needed it, all right? Including my family or even my neighbors, all that kind of stuff. So I have more masks, more gloves, all right? These trauma bandages, I have a bunch of them. These are like the Vietnam era of the, what do you call it, of the Israeli bandages, okay? Triangle bandages, 4x4s, all right? I have quite a few CPR masks, okay? Tape. This is all ACE bandages. These are 5x9s, what are these? Yeah, 5x9s. Okay, I put these in here as well. Okay, 5x9s, gauze. Okay, another splint, more tape, more surgical lube. These are more 4x4s in there. More tape. I also have the Benadine Q-tips. Okay. What else? I got 1x3s, and I have alcohol prep pads, and of course this is the old style of for your feet or anything like that. It's just a lot of stuff in there. First aid wash. Let's see what else. Anything else in here? Yeah, 5x9. So what this stuff is and why I stockpile it like this is because as I go along and as I make kits, I already have the kits. I already have the materials to make it. So I'm not saying that any of this stuff is going to go on sale anytime soon. This was a leg brace or a knee brace when I hurt my leg. But the idea is that if you have this stuff, if you stockpile this stuff, then as you go along and make your kits, as your training progresses, as you use it up, at least you have something. You don't have to run to the store to help yourself out. It's already here. Okay, so I think it's a very important part of your preps. So as always guys, thank you very much. I hope you enjoyed this video. Do the like and subscribe thing. If you want, go to threeriverblaze.com, check out all the great knives I have up there. Also check out Three River Kydex, and of course check out the Patreon page. I'll put all the links down below to where you can purchase all this stuff if you're really interested. And as always guys, please stay safe.